What is Medicare and how does it work? This is a popular question. A lot of searches for it, and people are still searching. They can't seem to find the right answers, or at least they can't understand what people are trying to tell them, and maybe it's because it's not being explained properly. I don't know. It's any number of reasons, but what I do know is if you spend a few minutes with me, maybe I can help you out. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. All right, people want to know, what is all this A and B and C and D, and why can't it just be like what I've had before? Co-pays and doctor networks and hospital networks, and I can go here, I can't go there. And then, but of course, if I end up having surgery, then I get these surprise bills. The insurance company doesn't pay for it. It's a hassle, but that's what I've been used to. Well, I got good news for you. If that's what you want, there's a Medicare Advantage plan out there with your name on it. But if you want something a little more simple, then let's spend a few minutes and talk about the way original Medicare works. I know at first it may seem a little bit foreboding with all the letters, the A, the B, C, and D, and it's kind of like that Godfather movie. Monday, Tuesday, Thursday, Wednesday. How do these things work? Like I said, it's actually pretty simple. The first thing is, if you go with original Medicare and a supplement plan, you're going to have a lot less out of pocket than what you've been used to. Instead of having several $1,000s out of pocket, most folks will have, if they pick a G plan, which I know means nothing to you, but if you go with the G plan, your out of pocket's going to be around $200 a year for health care. As opposed to $2,000 or $3,000 or $5,000 like you may have been used to in the past. And also you can forget about doctor networks, hospital networks, getting referrals, pre-authorizations, insurance companies saying you can't do this, you can't do that, or you can go ahead and do it if you want to. We're not paying for it, So you can forget about all that. It acts, like I said, it's actually pretty simple. And I come at this from a perspective of being in the health insurance for over 40 years. Plus, I'm on Medicare myself. I've worked the Medicare market exclusively since 2010. So I think I've got a pretty good handle on it. And I know the plan that you probably have now, I know the way that plan works. And I can explain the differences to you. And then you decide which way you want to go. Do you want to continue on that same path with getting referrals and having to follow company rules? Or do you want to let you and your doctor decide what kind of care is best for you? And that's really what it boils down to. But I can break it down a little bit further. I have my offer you can't refuse. Give me a call, spend 10 minutes with me on the phone. Ask me any question you want with regard to Medicare at the end of 10 minutes. If you want more information, I'll be glad to spend more time with you. But on the other hand, if you feel like I'm wasting your time, well, we hang up and part as friends. After all, it's not personal, it's just business, and that is my offer you can't refuse. This is Bob Vineyard with the Georgia Medicare Minute. You take care. Have a great day.